Is PiaTherapia.
So Pia, some people see that we're building a tool, but what I like to think, what I like to say is that we are actually teaching and bringing up a personal assistant for therapists. So you can imagine somebody that therapists can rely on to do all the tedious work for them, and that includes scheduling appointments and doing the notes for them, summaries, and also the most tedious part, financial documentation and tax-related stuff. Because our main paradigm comes from the data that in about 40 hours, a average therapist, they usually work more than 40, but in 40 hours they have around 15 to 20 clients in 30 hours, and then they have 10 hours of just paperwork, and that is a very conservative estimate. And they are therapists are a lot like artists. They really like to just do what they love to do best, work with clients, and we aim to 10x. We reduced by 10 times the amount of paperwork they have to do and save their time. Not only to be able just to take on new clients and make more money, but also to have more time for themselves, for their own personal health, to go on walks, hang out with friends, whatever.
That's a very nice point. We need our doctors, therapists, psychotherapists healthy as well, right? In order for them to help others. You are not founded yet, right?
No, we're not founded. We are in our go-to-market phase right now. I myself am focusing most on curating the best team for this right now. I come from a basketball environment background, so I know how important it is to have the best team. So right now we're honing this down, and the basics, marketing strategies, competitor research. We are building our modules and putting it together, and what I'm doing also a lot of things that don't scale, talking to therapists and clinical psychologists to really capture what their need is in this.
Basketball, finally somebody I can compete with in here. Otherwise, you are trying to be the best in the competition through partnerships as well, so invest in a goal we want to reach.
Yeah, we are talking with them. They have an amazing institute, Institut Andreja Marušića, and also Cora, Center za oblikovanje aplikacije, which we're starting to talk with them, and they can potentially be a partner that help us to have the extra added value compared to our competitors also. And also my amazing co-founder that I just found a couple of weeks ago, Petra, she's also going to probably do a PhD on this, so we have real scientific validation behind what we're building as well. And support of the scientific community and local as well.
So how did it all start? You were aware of the situation, right, with the rise of mental health issues, but you also come from the academic background that helped you to move into this way.
Correct, yeah. I've also studied neuroscience and psychology, and through personal experiences, bad unfortunately, in our family and close circle of friends, yeah, I've noticed early on, and then also through studying, through data, what the situation is. Unfortunately, it is in a decline, both mental health issues, self-harm, suicides, stuff like that. So our thinking is, our grand vision is to reduce the whole mental health issues for 10 times, basically 10 times everything we're thinking. It might be a grand vision, but yeah, that's how it started. We were thinking, who's already doing this? It's the social workers, it's the therapists, coaches, clinical psychologists. So we want to help them, and we also happen to have some knowledge and experience with AI, so I thought this was the best way how to help them to free their time.
And it's very much needed. That's why we have problem solvers like all of you here today. What kind of funding would you like to receive in order to realize all of this?
We're still dabbling with the numbers, but we're looking at just above 500,000 euros for the next 2 years to bring this on the market and fully develop.
Do you look forward to maybe go international one day?
Yeah, we want to start and test our product in Slovenia, then go to Northwestern Europe, and then US, and eventually